Welcome back. We're talking about sinusitis and surgical treatment options with Dr. Frnak Brettschneider. All right, Dr. Brettschneider, you talked about an implant. When would you use that?
Well, the challenges with sinus surgery in the past has always been, we can make great openings into the sinus, and then we would occasionally get patients where the openings would close on us. We've have a drug-eluting stent now that really prevents that from happening. I have a demonstration of this. This is called Propel. This is a drug-eluting stent that's dissolvable. It is inserted into the sinus cavity after we make the openings, and it lasts about a month. It releases kind of a modern synthetic steroid to keep the swelling down, to prevent the holes from closing, and it reduces inflammation. It prevents the need for packing, and it kind of makes sure everything stays open just like we did in surgery. I can demonstrate to you. Again, this is what the device looks like. It springs open into the sinuses. It's a dissolvable material, and you can see it just opens into a spring, and this dissolves in about a month period of time. That'll be in the sinus cavity, and the medication is embedded in this matrix, and it just melts away. It's very gentle. People can't feel it. It's very soft, but it keeps things kind of sprung open, and we'll insert that up into the sinus cavity. Works exceptionally well.
So it's not a rigid device. It's very soft.
It's soft and pliable.
Okay, yeah. And it looks like it's pretty open now, but of course it wouldn't be quite that big in the sinus.
It would be smaller in the sinus. It adapts to the size of the opening, so it can be very small or it can be larger depending on the opening of the sinus cavity and what you're doing inside the nose. So it's very adaptable for different conditions. But for somebody who has polyps or a lot of inflammatory changes, this works exceptionally well. And they're developing one that will be able to be placed in the office. If somebody has polyps, we can insert it into the polyp cavity or into the polyp area where they have it. It'll release this medication, reduce the size of polyps. So, and then they're also developing some potential use with antibiotics. So the future is really, really neat with this device. They'll be able to insert many different types of medications releasing into the sinus cavity. So right now we have a modern steroid that's very helpful.
Yeah, when you first said that drug-eluting stent, I'm thinking, am I talking about cardiology here?
Right.
Because it is the same kind of technology.
Same idea, same type of treatment. The only difference is this dissolves. This goes away after about a month.
You have an animation that's really cool that I'd like you to walk us through.
Okay, perfect. This is the device, and this is after surgery, after sinuses have been opened. We insert it into the sinus cavity. It springs open. It also holds that metal turbinate that you see on the left away from the sinus openings, and that spring keeps things nice and open. You can see the medication being released in that area locally. Again, it's not absorbed by the body, so this steroid is very safe. It's just locally absorbed. And then this is a picture of a normal sinus cavity that's working well.
Now, is this done in the hospital?
Yes, this device is only implanted currently in the hospital.
So the patient will be asleep or sedated while you implant that device?
Absolutely, and only McLaren Port Huron has this device available.
So you, I'm thinking you do whatever you need to do, whatever surgical procedure you need to do in the sinus, and then you use this stent? Is that how it goes?
Correct. Once we get the openings, once we maybe remove polyps or get rid of the sinus disease, at the end of the case we insert this, again, to ensure less swelling, that the sinuses stay open.
And how long does this symptom, you said that's in there about a month, and it's let off that steroid, which is helping.
Right.
How long does that last?
Well, this lasts about a month as it releases the medication, but by then the sinus openings have healed. And so the healing process is becoming complete, and there's no further need for it anymore. But it's crucial during the early healing process to get rid of the inflammation, to make sure everything kind of stays open, is sprung open with this type of device. So after the healing process, it's not needed, but during the initial phase, it's essential to use this in many patients to ensure that the openings that we make stay open.
It sounds like there's a lot of exciting advances going on for sinus surgery.
Absolutely, absolutely.
So you've got antibiotics on the horizon, you've got other medications on the horizon.
Right, and the combination of antibiotics and steroids mixed together in these devices. So this is going to be a huge future improvement with sinus work, and it's changing all the time.
Great information today. What kind of closing comments do you have for us?
You know, historically, treatment of sinusitis, you know, I remember back in the 80s, we make incisions under the gums, painful, a lot of nasal packing. Those days are long gone. And now sinus surgery can be done easily on an outpatient basis, sometimes in the office, much more effective, much easier on the patient. So the old historical sinus surgery has really changed, and I think people just have to understand that it's a lot easier process now to get those sinuses open so they work better.
You know, that's really important point, because I think people think of sinus surgery, like you said, nasal packing, lots of stuff, but this is much simpler.
Yeah, the cool stuff. It really has made a big improvement for the surgeon and for the patients also.
Thank you so much for joining us.
You're welcome. Thanks for having me.
And thank you for joining us. If you have any questions about anything we talked about today, you'd like a copy of this program, call us at Health Access. That's 1-800-228-1484. You know, we have an absolutely awesome website, and that's mclaren.org/PHTH. You can go there. You can watch any segment of this program. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.